Good morning, and thank you for joining us for an update on our IT outage impacts across the health and health-related systems. I want to again welcome Dave Diamond, President and CEO of Eastern Health, and joining us virtually, Pat Hepditch, Vice President of Solutions and Infrastructure with the Newfoundland and Labrador Centre for Health Information. At this stage of our investigations, we can confirm that we have been the victims of a cyber attack which has impacted our healthcare systems. We have, as I mentioned on other occasions, engaged cybersecurity experts to help us investigate and resolve the matter. We've also informed the appropriate authorities. Those investigations are ongoing. So we understand there's been a lot of interest in this matter, but it is under investigation at this time. Those involved in the attack may actually be monitoring what we are saying in media and on the floor of the House. It's very important, therefore, we don't do or say anything that compromises the efforts underway to investigate and resolve this matter. To manage the outage, we activated our Provincial Emergency Operations Centre, and each of the regional health authorities is in a code grey situation, which means effectively they've done the same. We have technical, operational and communications teams working with the RHAs to keep Newfoundlanders and Labradorians updated about the systems that are impacted. Through our continued investigations, we've confirmed there were system impacts, after all, in Western, and out of an abundance of caution, we've had to take the Western Health system offline this morning. Western Health will be implementing their downtime procedures and adjusting their operations accordingly. They will be releasing further information, but a summary is that their Meditech system, the main information system which manages patient information, will not be operational. And as a result, Western Health will implement a number of reductions in services at hospitals and health centres for today, Thursday and Friday. Only urgent and emergency appointments will proceed for surgery, endoscopy, blood collection, medical imaging, outpatient EKG and fracture clinics. The following services will not be proceeding. So that's orthopaedic central intake, pre-admission clinic, the pain clinic, pap smears, as they require either blood collection or medical imaging or laboratory to support their work. Chemotherapy appointments at Sir Thomas Roddick Hospital and Charles Le Gros Health Centre will proceed today, November the 3rd. Clients will be contacted directly regarding their appointments on Thursday and Friday. Chemotherapy appointments at Western Regional Hospital will not be proceeding. The virtual breastfeeding support group on November the 4th will not be proceeding. If you have not been contacted to rebook your appointment over the next week, please follow up with your healthcare provider. And if you've got any immediate concerns or questions, please call 709-784-5470. As the current online portal for COVID-19 test results are not available, if your result is positive, you will be contacted by Public Health. If 72 hours have passed since the time of your test, you're not symptomatic, and you've not yet heard from Public Health, you can assume your test is negative for the time being. Individuals who require COVID-19 testing in Western Region are advised to call 1-833-608-1115 as the online assessment tool is not operational at this time. All of our regional health authorities are implementing downtime and backup procedures, and the public will continue to be updated by them and us as we know more. Obviously, this is a huge inconvenience, and we sympathise and empathise with people, particularly who are distressed by having their health care impacted. We are and will continue to do everything we can to keep you informed. This is a team effort with everyone pulling together to try and resolve this matter. but we are facing significant challenges and overcoming them day by day. Our main focus here is the people of Newfoundland and Labrador and their access to healthcare services, and working to restore that in as safe and as rapid a fashion as possible. So that being said, I'm going to turn it over now to Mr. Diamond to provide an update on Eastern Health Services, for which he is responsible. Dave, thank you.
Thanks very much, Minister. And you mentioned that this is a team effort, and I would just reiterate that and say thank you again to the many people, frontline staff and physicians, managers within Eastern Health and the regional health authorities, but also with the Centre for Health Information. We'll hear from Pat shortly. The technical teams at Nilchi and at Bell have been literally working around the clock to try and resolve these issues. And within the health system and frontline staff and physicians who rely on these systems, we're very thankful for the work that they are doing, and optimistic that in the days ahead this thing will be resolved. Our situation as Eastern Health has not changed significantly since we updated a day or two ago. We have been doing emergent and urgent procedures for the primarily. Our emergency departments are open, and so if people need care, as the minister said, your primary care providers are still operational. Our emergency departments are still operational. If you need emergency procedures, they are available. Our clinical leadership teams are triaging and looking at, on a case-by-case basis, where the urgent needs are. And so urgent and emergent surgeries, for example, some cardiac procedures, other procedures within Eastern Health are proceeding, but non-urgent are not. And one of the challenges we have, of course, with our systems being down is being able to communicate. And so if you have a procedure that has been scheduled and is deemed by your clinical team to be urgent and emergent, you will receive a call from us. So you will know that you're in that category. If you don't receive a call from us and you're scheduled, you can assume that you're not in that category and that your procedure will be rescheduled. I know for many people this is a very difficult time, and we appreciate that. We are doing everything we can as a team within Eastern Health and working with our partners such as Nilchi to resolve this. And we know there's lots of angst, and so there is a 1-800 number, or actually a 1-833 number, where people can call if you're uncertain. We do have information on our website, we're on social media and on Twitter. But if you review that, or if you're not able to review that and you still have questions, we have a number 1-833-777-1276, and we have resources available there late into the evening to answer your calls as you're trying to sort through your own personal circumstances around your situation. I know since Monday we've heard stories of individuals who have traveled from places like Labrador, for example. We are working on a case-by-case basis with anyone who identifies that they were not able to access information prior to some of these changes, and you've actually gotten on a plane or in a car and traveled long distances, and hopefully you have been in contact with us. If you have not, and you're in the city, and we would like to hear from you, and we would like to work with you to see if we could get you scheduled in at the earliest possible opportunity to avoid some of the additional costs that we know some families have incurred already. I think, Minister, that's the overall update, and I'll be happy as we go to answer any questions.
Thank you very much, Dave. And again, thanks to the team at all of the RHAs and Centre for Health Information, because, as you said, they have been working around the clock with our IT systems provider. We have a new face today. That's Pat Hepditch, and he is going to provide an update for us regarding the impacts to the Newfoundland and Labrador Centre for Health Information. Pat is joining us via Zoom. So over to you, Pat.
Thanks, Minister Haggie. So early Saturday morning, NLCHI's on-call staff are notified of information systems being down we heard from both Central Health and Eastern Health. I happen to be the executive on call for the weekend, so I initiated an incident command team, reached out to our technical leadership, and we brought a team together and began troubleshooting and investigating the problem. It quickly became clear that we were looking at a pretty extensive outage in the IT infrastructure supporting the RHAs. Having learned that, we reached out to the RHAs and advised them of this, and advised them also to begin activating their downtime procedures. The impact of this, to reiterate, has been varied somewhat among the regions. Eastern Health and Central Health were hardest hit, with the majority of their critical systems being entirely unavailable. Labrador Grenfell was also seriously impacted. A number of their critical systems are connected to Eastern Health, so they were taken down through that connection. And as the Minister was saying, Western Health initially did not appear to be hit as hard. However, in the last day or so, to be careful, we have decided to take the Western systems offline as well, and have also advised them to activate full downtime procedures similar to the other RHAs. Through the course of our investigations and troubleshooting, we determined that an unauthorized third party has compromised their systems. We're working hard now to gain a full understanding of the attack, but there are still many unanswered questions. And in the meantime, as Mr. Diamond said, the NLCHI and Bell teams have been working very hard around the clock to recover and restore and bring the RHA operations back to normal as soon as we can.
Thank you, Pat. I think before we turn it over to Leslie for moderating the rest of the availability, it's useful at this point to emphasize Mr. Diamond's comments that if you are acutely unwell, care is available. The ambulance system is functional. The emergency rooms are open. It is a situation where we are all trying our level best to maintain and restore the services we have. But I think it's important that people of this province realise that if you're acutely unwell, care is available. So with that, I'll close, Leslie, and hand things over to you to moderate the question and answer.
Thank you, Minister. We have 8 media registered for today's availability. There will be 2 rounds in the question and answer session, which will give each reporter the opportunity to ask 1 question and 1 follow-up per round. Our first questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
Mr. Hepditch, you said the goal is to get systems back as soon as possible. We're 4 days into this, and in fact, the impacts are getting worse, not better. Give us a sense of what sort of timeline you're looking at to be able to at least start restoring some of the services. I believe you're on mute. We can't hear you.
Sorry about that. So it's very early in the process, but the restoration process is underway. It's difficult to say exactly how long it will take, but we are working hard to try to get things back up and running in the next several days.
This is presumably the sort of thing that you anticipated. Cyber attacks have hit healthcare systems elsewhere in the world. Why isn't there a backup plan in place that would have restored services a whole lot sooner than, again, 4 days, and we still don't know when it's going to happen?
These kinds of incidents often result in extended outages. We do have a backup plan. We are working hard with Bell to restore things as quickly as we can, but this is there's a lot of uncertainty, and we need to proceed slowly and cautiously to ensure that what we bring back online is stable and secure and safe.
Our next questions are from Glenn Whiffen with The Telegram. Please go ahead and make your way to the mic.
Great, thanks for taking our questions. Just wondering, is the attack, for lack of a better word, over? Like, are systems still being impacted, or are we in a rebuild mode now?
From my point of view, and Pat may be able to add something to this, we are not yet clear on the total extent of the failures. We know we have been subject to an attack, and beyond that, the extent of it will only become apparent as we work through the processes that Mr. Hepditch has started to outline.
As each day goes by, how far behind are we getting with medical appointments and procedures that are cancelled or delayed?
As we said in our last update, there are literally thousands of various procedures, and they range everything from an appointment to have your blood drawn in a lab to more significant surgeries and cardiac procedures and so on. So there are many. I think I said thousands on Monday, and I think that's as close as I can come today. But there are many procedures. On the upside, as we've also talked about, we've had considerable experience in the last couple of years in being able to, once this kind of a circumstance is over, in being able to address those backlogs. And so we've had the experience of Snowmageddon, and we've had a couple of rounds of COVID where we've slowed down or stopped services. And in the weeks following, we have been able to add in additional appointments. And so at this stage, we're not, we're concerned, but we're not, we're confident that we can address this circumstance once we get to the point where our systems are back up and running.
Our next questions are from Ben Cleary with NTV. Please go ahead and make your way to the mic.
Hi, thank you. Has there been any communication at all with the cyber attackers?
We, when we became aware of a possible cyber attack, engaged experts and the appropriate authorities. Best practice is not to comment any further on what may or may not be happening. It is important that we here now do not say or do anything that could jeopardize the rebuild and our attempts at mitigation. So I'm not going to be addressing any of those kind of questions openly. This is for the experts to deal with.
Thank you. My next question is for Mr. Diamond. How have mental health and addiction services been impacted at Eastern Health?
Well, many of our mental health and addiction services have been able to be maintained. Doorways, for example, are continuing. There have been some impact on psychiatry services because, like many of our other specialist psychiatrists, they use our electronic systems. We are in a discussion with mental health now to see even how we might get that back. So mental health actually has been one of the services that's it's had some impact, but not as intrusive as in some of the other parts of our acute care system.
We will now go to the phone. Our next questions are from Renelle Legros with All Newfoundland Labrador. Please go ahead.
Are you able to offer any more insight into what changed in Western Health for the decision to be made to take them offline?
I can take that one. As I said, there's been an ongoing investigation to understand how this attack is functioning since the outset, or since we realized it was a cyber attack. Without saying too much, as per the minister's comments a moment ago, it became apparent to us recently that the safe thing for us to do would be to take the Western Health systems offline. So we've done that now, just to further contain the breach.
You mentioned, I think the minister mentioned a couple of days ago at the last update that there were The government was working with experts on this. I'm wondering who they are, what are they doing? Have they arrived in the province to help out, or are these folks helping from a distance?
I think it's important that we realise that this is a very specialised area. We have experts at national and probably, one could argue, even international expertise. The mere fact of identifying them will actually jeopardise the potential for mitigating the damage that we've currently suffered. And so it's really crucial that in answering the questions that you give me, I do not inadvertently provide a roadmap for someone who is really not interested in, necessarily what we are, as far as the system is concerned, to actually make the situation any worse.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Are you able to comment any further on what type of cyber attack this is?
No.
Okay, and do we know if data has been lost? And if so, if we'll be able to get it back?
Those items, that question is as yet unclear. And again, that's about as far as I'm prepared to go with that particular line of questioning. Sorry, Sarah.
No problem. Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Question for Mr. Hepditch. You mentioned a little while back in the press conference that you're hoping to get things back up and running in the next several days. Does that mean fully back to normal? What's the timeline for having things fully back to the way they were before this attack? Is there one?
I'm reluctant to get specific in terms of timeframes, but what I will say is that we've been working with the regional health authorities, going through the list of impacted systems to define a sequence for restoration so that we bring the most critical patient care systems back up first and proceed from there in an order of priority. The actual restoration process is going to, in itself, will take days to get to the point where we have everything back up.
And maybe just a little bit more clarity on that point. I guess what is the order of priority for having services be brought back in? How is that going to look? Maybe that's a question for Mr. Diamond.
Yeah, thank you. It's a difficult question to answer with a lot of specificity. One of the areas we have made a priority in our discussions with NILCHI is our systems in cancer care. And so at the same time we're working on cancer care, we'll be working on our main IT system. So I think other than to identify cancer care as a particular area that we're interested in, we don't have a roadmap yet to say which of our acute care services we'll bring up first. I think if we can get our main IT systems up, it will allow us actually to bring a lot of the services up at the same time. That's not a very specific answer, and it's a great question. We haven't really identified it in that level of specificity.
If I could make a further comment on that, I think it's important for people to understand that it's not a matter of flipping the switch and everything comes back up. As I said, there is a pace at which this will happen. But more importantly, as we do this, we need to do it very carefully. There's a lot of testing and validation and measures to ensure that all the systems, as I said earlier, will be stable and secure in the process.
Our next questions are from Leila Baudouin with The Independent. Please go ahead.
Thank you. We know that the management system has been attacked, but phone and email service as well. I'm wondering if you can provide more details or explain where the problem is, what exactly was hijacked.
That's a very good question. It's a technical question. That's a question for the experts who are looking at that, and simply answering that question in any way, shape or form is likely to cause major problems in terms of mitigating or compromising our effects, our ability to deal with the situation as it is. It is really important that I don't, in my comments here, provide a handbook for the next person who wishes to do the same to our system again.
Right, but we know you're working with Bill, and we've heard them mention a few times. Can you provide more details, I guess, on how that works and what they play in this situation?
I'm sorry, Layla, I missed part of your question when you asked we're working with whom?
The service provider, I guess the layers and what's gone on here. So we know it's management systems, but I'm just wondering if you can paint a more accurate picture or more details on what this looks like.
The service provider that we use provides hardware, software and infrastructure to NLCHI on a contract, and this is not an unusual situation. So they are invested and investing significant time and effort, again, round the clock, to renovate, rebuild the systems so that we can then do as Mr. Hepditch described, which is to bring them back online. To go any further and even confirm or deny which system specifically may or may not have been involved, again, provides information to people who will not use that in our best interests.
Okay. I interviewed one woman who bused to St. John's from Corner Brook after the announcement was made. Her daughter had appointments at the Janeway this week. She says thus far she hasn't had help and is scrambling to cover the cost of added expenses. Can we talk about these people some more and what's being done to address their situation?
Dave, do you want to take the Janeway?
Yeah, it's a great question. So, I mean, there's a couple of layers to your question. One is around the clinical care. And so, I mean, I would encourage anybody in a scenario where they have come into the city to receive a procedure, as you say, at the Janeway as an example, that they reach out to us either through their clinical team or if there's no other way to do it, then through the 1833 number that we talked about earlier, to make themselves known and identify their circumstance. And we would want to hear from them to understand if there is anything that we can do to expedite care, even in the short term, and get them looked after and on their way. We also then could have a conversation with them around expenses. It's not a normal scenario where we would identify or we would reimburse expenses, but I think we're open to those sorts of conversations if there's anything that we can and should be doing. So I don't have a specific answer. We don't have a program per se to cover this kind of a circumstance that I'm aware of. Perhaps we do somewhere, but we would want to hear from those folks about their circumstances, first of all, to ensure they get the care they need as expeditiously as they can. And then if there are other things that we need to do to support them, we'd want to know that as well.
Certainly, just to follow on from that, as far as the medical transportation programs are concerned through the Department of Health, we've had questions in the House about this, and essentially we would view very sympathetically anybody who found themselves in a situation whereby, through no fault of their own in this particular incident, that they had incurred expenses for no healthcare benefit. What we need from them is some information, and the MTAP or income support transportation lines would be available to them.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you, Mr. Hepditch. I know that you can't get into the specifics here, but I'm wondering if generally you can speak to, have you identified any weaknesses in our system that could have allowed this to happen?
as you say, I certainly can't get into any specifics, but I will say that both NLC, CHI, and Bell, have strong security postures. We use industry standard technical safeguards in our best efforts to prevent these things. But like so many other organizations who have been victims of cyber attack, the incidents happen despite our best efforts.
And I know that you said that in your preamble that you're working hard to gain an understanding of the attack, but there are still a lot of unanswered questions. Can you say what some of the unanswered questions are that you have at this time?
I'm going to take that, Richard, if you don't mind. The last two questions, whilst perfectly understandable, and I get where you're coming from and your interest, it's a bit like saying, well, Dr. Haggie, you're in St. John's. Just give me the passcode to your door lock at home. I'm not doing it.
Our next questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
Mr. Hepditch, I've been talking to some experts in this area, and they say there would be benefits to publicly releasing what sort of hack is happening right now, because there may be experts in the world who've maybe quietly been able to circumvent this and don't want to publicly put up their hand and say, we know how to do this, who might reach out. Considering the hackers already know what kind of hack this is, why can't we provide more information about that?
That would be counter to the advice that we're getting from our experts. We're sticking with that advice. We are very confident that we're being well advised through this.
And one of the comparisons, I guess, would be with Ireland, who faced a similar sort of attack earlier this year. They came out on day one and said, this is a ransomware attack, and we are not going to pay a ransom. And they ended up getting the key with no money being spent a week later because there was that public pressure. So why are we not going that route? It worked for them.
Again, without getting into specifics, it may not work for us. And we have experts retained. We've got the appropriate authorities involved. And as Mr. Hepditch says, we are following their advice. They know this area. This is not healthcare. This is cybersecurity. And these people are world class in their field.
Our next questions are from Glenn Whiffen with The Telegram. Please go ahead and make your way to the mic.
Mr. Haggie, the opposition has called for an emergency debate in the House of Assembly. Do you think that's an avenue that would help in this situation?
The Speaker ruled on that yesterday, and MHAs do not challenge the ruling of the Speaker. Certainly I'm aware that the Premier has had conversations directly with the opposition leaders and to kind of keep them up to date and up to speed. I really think that debating security protocols of our healthcare systems in the House of Assembly would, again, be providing a handbook for the next person who wanted to do it.
Thank you.
Glenn, do you have a follow-up question?
No, that's good. Thank you.
Good to go. So the system was already stressed. 1 in 5 Newfoundlanders and Labradorians didn't have a family doctor. What's your message to people who are maybe even more stressed now because their appointments are getting canceled?
That's a very understandable question, and we have heard that. It's distressing, it's difficult, and I appreciate that. Again, this happened through actions of others, deliberate actions of others, and so we are going to work through this as best we can, as safely as we can, and as fast as we can. And as Mr. Diamond has said, and consistent with the other regional health authorities, there will be a continuous examination of those appointments that have been cancelled. If, however, in the meantime you find your condition, your health has deteriorated, significant proportion of primary care providers have not been impacted by this directly. Emergency rooms are available, the ambulance service is available, and 811 is available. So I would encourage them to reach out.
And how concerning is it to be sitting here in the media center or speaking in the House of Assembly and knowing that maybe the cyber attackers are listening to those briefings or conversations?
It's an exercise in self-discipline. We need to be careful what we say and what we do. And it's difficult sometimes because the easiest thing in the world would be to answer some of your questions directly. And quite frankly, what I've done is distance myself from some of the technical information. So in my enthusiasm to help you, I don't actually inadvertently make the situation worse. It's hard.
Thank you.
Before I move to the phone, I just want to be clear. Ben Cleary, was that your two questions?
Yeah, that was it for me.
That was Ben.
Okay, thank you. Our next questions are from Renelle Legros with All Newfoundland Labrador. Please go ahead.
You mentioned that you're rebuilding the system. Are you able to do that with the existing infrastructure? Is there a price tag that's associated with that? When you say rebuild the system, can you sort of explain that a little better?
The short answer is it's a technical question, and again, it encroaches there on information that really should not be released in public. I think in terms of a price tag, at the moment, we want this fixed. We'll do whatever it takes, and we'll work out the price later.
And I'm just wondering about Central Health and Labrador Grenfell Health. Can you give me a better understanding about what operations look like there today? Have they canceled appointments as well?
Yes, they've both been impacted. Central, I think, more than Labrador Grenfell at the moment. They are each releasing public service announcements today to provide that level of detail. Central's is not that much different from what I recall from Eastern Health's, but I would refer you to the specific RHA for operational questions like that. But there is a list out there, and it will be updated regularly.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
What kind of implications on health outcomes are you expecting or planning for as a result of this?
That's an unknown. We have seen with the delays that were occasioned by Snowmageddon and COVID, we've seen backlogs, and as Mr. Diamond referenced, those have been worked through to a significant extent based on clinical need. Quite frankly, if this is shorter break than longer, it will be easier to mitigate, and the outcomes are likely to be less prolonged and less severe. But at the moment, it's going to be really difficult to quantify because we don't have access to some of the data we would normally use to at least give you an estimate. So I think we'll only know afterwards.
Okay. And I've spoken to a number of people who say, for example, it's taking quite a bit longer right now to get results from emergency blood tests, things like that. What do you have to say to people who have maybe recently had an investigative sort of procedure done, like imaging, and are worried now that perhaps their data may be lost and the outcomes of those procedures may now be delayed?
Certainly, it's a distressing situation. I'm not trying to minimize it at all. There may be an opportunity for contacting your specialist who ordered the investigation. There may be some ability to access that. In terms of what data may or may not have been compromised or lost, again, until we work through this process, that isn't going to be clear. And again, we'll try and keep you as updated as we can as we know new information. But there's no doubt it is difficult. And I think if people are having significant emotional and psychological impacts from it, we do have resources available, and I'll make sure that our department and the RHAs put those out.
Thank you.
questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi. Just in keeping with this comparison with Ireland, in that country they saw the impact of the cyber attack go on for months and months. Could that happen here? Is that where we're headed here? Because in listening to your comments this morning, I can understand why someone will get the impression that we're headed back to normal, we're going to be back to normal in a few days. Is it actually going to take longer than that?
The honest answer is, at the moment, Patrick, we don't know until we start moving down this road. Analogy I used yesterday was like a journey. We know what the next 2 steps look like, but we don't know what the next 500 meters looks like. So it's going to be difficult to predict now what may or may not be a problem in a few weeks' time. And it may well be like Ireland. We discovered glitches in the machine, shall we say, sometime down the road. The important thing is that we work on priorities and get the priority systems back functioning safely as soon as we can, and then build out from there. It will be some time before we'll be able to answer that, quite honestly.
My second question is for you, Mr. Haggie. You said a few moments ago that you are purposely distancing yourself from some of the information regarding this issue. Is that appropriate for the Minister of Health to be purposely distancing himself from information, especially when you're here as the spokesperson for government about what is happening? Is that an appropriate thing to do?
I'm distancing myself from the technical elements. I don't need to know coding. I don't need to know IT infrastructure or networking and switching protocols. What I need to know is what the impact is, what the timelines are for restoration, and how we mitigate the effects, and to make sure that all that can be done to mitigate these effects and restore as good a level of service as we can is done. I believe I've done that. When I made that statement earlier on, it was simply out of prudence. I'm an inquisitive individual by nature, and quite happy to be expansive, and this is not the situation for any of that.
Our next questions are from Layla Baudouin with The Independent. Please go ahead.
I read that hackers' new tactic is to target healthcare institutions because of the pandemic, which has increased pressure on victims, which I guess in this case would be Newfoundlanders and Labradorians. Who makes the call here on how much pressure or how much more pressure our healthcare system can take?
An interesting, if slightly philosophical question. I mean, we've had Snowmageddon. Following on that, we've had COVID-19. We've had variants. We've had waves, I think 4 now so far. And now we have a cyber attack. You deal with the situation as you find it, not as you wish it would be. We survived Snowmageddon. We're doing very well and setting international trends for COVID, and we'll get through this.
Okay, thank you.
Layla, do you have a follow-up?
I do not, thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you, and this question is for Mr. Diamond. Eastern Health is primarily on a paper-based system right now. Mr. Diamond, how long are those paper records kept for, and what is being done to assure that any information collected now during this period is properly transferred over when the system comes back online?
Yeah, good question. So we would have a variety of paper-based records even in our normal operations, and so there are standards that require us to keep some of that. If we're not scanning it into an electronic format, we keep that for a number of years, and so we have full facilities of storage of paper records. In terms of what's directly related to this incident, one of the things we've done is gone back to see, we have paper records that we scan into our IT system, and usually our turnaround for that is 30 days. This is the only time I've ever said I'm really happy that our turnaround time is not what it should be. So our records actually we've found are going back for 90 days. And so we do have a capability for some of what would normally be in our IT system that are still in paper going back 90 days. And so, that may or may not be helpful to us as we get through the next few days. If we have a scenario where we have to manually enter information back into the system, again, as the minister said, we've been through numerous critical situations in the last period of time. We will put a team together, whatever the resources are required, to ensure that that manual transfer of information back into the system is done in a timely way, and that'll kick in as soon as we get to the point where NILCHI tells us we can turn the systems back on, and we're ready to go. So we are not concerned that any information that is collected, certainly since the weekend up till now and whenever this is over, we will find ways to get that back into the system, absolutely.
And yesterday in the House of Assembly, the opposition asked if government will declare a state of emergency because of this situation. Dr. Haggie, now that another system has had to be brought offline, is that something that should be considered, or would it be beneficial at all?
We actually already have a public health state of emergency. I'm not sure one as defined under the Emergencies Act or under the Municipalities Act would actually add any levers that we don't already have pulled. Quite frankly, we've got emergency operations centres up in each of the RHAs. This is a healthcare issue. It doesn't appear, from what Minister Stoodley has informed us, that there's been any impacts outside of that. So really and honestly, I think it really doesn't add anything except potentially create more of a feeling of panic and disquiet in the public. So if there was a measure that we needed and that would provide, then yes, but currently no.
Thank you, everyone. Minister, do you have any final comments for today?
Yes, thank you, Leslie. This is a really important topic. I think everyone is concerned about the situation in which we find ourselves. And I think the key messages from my point of view are that care is available if you are acutely unwell. We are working hard to restore care as rapidly as possible to as near normal as possible. And it really has been a team effort. We don't often see technical staff from NLCHI here in the media, and I'd like to thank Pat Hepditch and through him his entire team for basically being on their feet since 6 o'clock Saturday morning. Again, Dave and Eastern Health staff, along with Central, Western and Labrador Grenfell, have mirrored that level of input and energy. And I really can't say enough good things about the amount of effort they've put in. So again, care is available if you need it. Take care. We will get through this like we got through Snowmageddon and like we got through COVID-19. Thank you very much.